Hello and welcome to TNIE Online. This is Chetna Belgare. Today, when India is in its third wave with surge in cases majorly driven by the highly infectious Omicron variant, Dr. Angelique Coetzee, Chairperson of South African Medical Association and one of South Africa's doctor who first identified the Omicron variant in the country, is with us to give us some insight on how the situation is now in South Africa and what lessons can India learn from the situation there in South Africa. Dr. Coetzee, I spoke to you in early November when we discussed on this variant, which was just found and which had already become notorious there in South Africa for some of its characteristics like spreading like wildfire. Today, 2 months down the line, what is the situation in South Africa and how much do we know about the variant now?
I'm so glad, thank you. And I'm so glad that we can have this follow-up conversation because currently what is happening is we are moving out of this, well, we hope that we will move out of this fourth wave of Omicron within the next 3 to 4 weeks. At this stage, it seems most probably, if I look at our numbers that from yesterday, and yesterday we'll report to the day before. Yesterday, we only saw 2,409 positive cases with a positivity rate of 17%. And then also the patients that died was not a lot of them. I'm just 77 new cases. So positivity rate 14%. This is really coming down nicely, our numbers. Mm-hmm. What we have seen with Omicron is it's got a very, very steep spike. Okay. Goes up very fast. And I think that is what is worrying a lot of the countries. But once if it reaches the top, it comes down just as steep. And I think that we should not so much look at how many cases there are per day. The cases there are per day, which should be a guideline to say what is happening in your community and how ready and willing people are to go and get tested. And then also each one that's positive, you know, you can take them out of the mainstream of people every day. So very important to that. But more important than to look only at your positivity rate is look at your ICU and high care rate and deaths per day. Mm-hmm. That's what you actually need to look at. Okay.
And I mean, that's some good news for India. As of now, I think, like you said, positivity rate is definitely going up. But then, so far, admissions to hospitals have been less when compared to the second wave. And hopefully, that this continues. So we know that India is in its third wave and virologists are convinced that it is now Omicron-driven wave. So when do you think India would peak? I mean, if you saw the variant was found in South Africa in November, early November. So when did you see the peak and can we do a comparison? Is that possible to kind of predict India's peak and how bad is the peak going to be like?
So I think one can, in a way one can, because if you look at India, it's a very big country. It's got large urban areas. South Africa also big, large urban areas. The vaccine rate, I know people love to say that a lot of people are vaccinated, but you know, if you really look how many people above the age of 18 are vaccinated, I think then also that is not a lot. You also are struggling. I don't think you are near 70 or 80% of people in the whole of India that's been vaccinated. South Africa, we're around about 45% above the age of 18. Yes, we do have maybe less older people, but maybe the difference lies also in the type of vaccines. But we know that nearly all these vaccines protect against severe disease. So if you have more older population not vaccinated, they might get a more severe form of COVID or Omicron than than people vaccinated. So you always want to get in your population, your older people, your more vulnerable people first vaccinated before you start with the younger groups. And hopefully you are busy with that in India. So if you look at that and the question, when would you peak? You should peak by the end of this month, beginning of next month. Of course, you started around about, I think, 3 weeks ago, if I'm not mistaken.
Yes.
So you should give it about 6 weeks.
Okay.
South Africa was around about, a month, 5 weeks, 5-6 weeks. We also then peaked. So more towards the end of this month, beginning of next month, you should be able to peak.
Okay.
And then again, don't get excited or disturbed by the numbers of positivity.
Okay.
That's not what you need to look at. How many are in the hospital? That's what you need to look, because a lot of people can test positive.
Yes.
But if the ICUs and the high care are not overwhelmed by really, really sick people, it means the system can cope with it and should be able to cope.
So you're saying that if we peak by, say, early February, when do you think, this is the question which is on everybody's minds. When do you think we will see the cases coming down? You said 6 weeks, right? So that would be
6 to 7, yeah.
So that would be sometime early April or end of March?
So your cases, to come down, let's say you peak in, let's say the second week, for argument's sake, second week in February. Your cases should come down just as much as they had, went up. It should just as steep coming down. That's what we see. We saw the first 2 weeks post a peak, it come down, slide, and then it starts now to really come down, but not gradually. So it just as fast as it peaked, just as fast as that, the gradient became less steeper, going down, sorry.
Okay. So you have been stressing on how we should not really look at the numbers of how many cases, but instead look at the hospital admissions and whether we are able to take care of that. So when in South Africa, during the peak, what were the kind of people who were in ICUs? Did you see any particular age group or any particular kind of population which was in the ICUs and which needed extra hospital admissions?
Very good question. What we saw is that people in ICU, in high care, predominantly 50 years and older. There were people between 30 and 50, but majority older than that, unvaccinated people. And then again, we saw people who had been vaccinated also, getting severe COVID, but normally they also had other comorbidities. Very seldom that we see someone actually healthy, vaccinated, and then end up in ICU. There's always either blood pressure or diabetes or something, or overweight or something, with it. What we call comorbidity with it.
So we also, there is a difference between getting admitted with COVID and getting admitted due to COVID, right? So somebody who's there already due to other comorbid issues, but then they are infected with COVID. So is there any, do you think we should look at that data specifically?
Yes, you should look at that data. So if we look at the data currently in South Africa, people that's in the hospital, as in now, over 666 hospitals. Let's give you the numbers. Currently, we are seeing that, and this number stays more or less the same. Ventilated patients, 323. So these 323, it's the past week, it's between 300 and let's say 325 for argument's sake. Doesn't really have a huge increase in those ventilated patients numbers.
Okay.
And some of these patients, the majority of these would be due to COVID, but some of these patients might also, have other diseases or motor car accident and then test positive. But the majority would be viral infection. Then oxygenated, again, across South Africa, 1,300. That's not a lot of people. And that number also stay more or less very constant, stagnant type of number. So if you then how many people are currently admitted? In the hospitals, 8,800. But that 8,800, some of them would test positive for COVID when they are screened in the hospital. They're not there because of COVID, but we will report them as COVID. And I think this is where we need to start to clean up the data, to say this is a patient that's really admitted for COVID. We know that Steve Biko Academic Hospitals got very good data where they looked and say, okay, these people are admitted for COVID, and with Omicron, the length of stay is around about 4 days, between 2 to 4 days, where with Delta, it was 8 days and more.
Okay.
So you can see there we have real great data, but the majority of ICUs doesn't always report the data in that manner, that how many people are there really because they have COVID positive, how many are there because of other reasons and tested positive. So we really need to clean up that data better, and that's all across the world that we have seen this.
How has the recovery rate been in terms of even mild, moderate, and severely infected patients? What has been the recovery rate?
Well, the recovery rate on the mild patients, if I take my own surgery, it's 100%.
Okay.
The recovery rate on severe disease, again, it's difficult because if you die and you had COVID-19, whether it was as a result of that COVID-19 or whether it was a result of something else, but because you tested positive, it will still be counted as a COVID-19 case. So the interesting thing would be to see in a month's time that was what we see with Delta, although the numbers with Delta was quite high, but there was undocumented cases. The cases that people, the access case, burial of people was extremely high. And we suspect that number was actually positive cases that was never been recorded. So you need to look at your access number going forward with Omicron, during the Omicron period, to see was that really the number of deaths, or is it higher? My gut feeling is it won't be very high because we didn't see a lot of people perish with Omicron.
We have the Omicron variant, and then now we're already talking about sublineages, and then there is Deltacron, and then I don't know what all. I mean, there are quite a few coming ahead. So have you seen any kind of sublineages of Omicron? And what about the possibility of another variant now?
We haven't seen anything yet in South Africa. Okay. We do test. We still test. I still test every day with patients coming in. Although I must say the past 5 days, we haven't picked up any new cases. Even people coming in, thinking they do have COVID, we haven't seen any positive people. So for now, I don't think. I think as quick as it comes, it just went away that quick as well. Okay. Regarding the cases that, or the people that you think would be sick afterwards or having long COVID or any of that, we haven't actually experienced any of that. You'll have to wait for that with people discharged from ICU, especially those that's been ventilated. But the majority of people in the publics, in the communities, we haven't seen long COVID symptoms from Omicron. Do I think what will happen in the future? I think, well, it might become endemic. We might get a new variant going forward. And, as long as we get new variants, more or less the same type of Omicron, I think we would be safe. Okay. If we, however, get a new variant with Omicron fast spreading capabilities and Delta severity, we will be in trouble. But only time will teach us that. And as long as we keep on wearing masks, because masks prevent the virus from spreading, okay, I think we might win in the end of the day, because it's not only vaccines that's going to get us out of this pandemic. It is other non-pharmaceutical interventions as well, and common sense.
So I just, one more thing I wanted to ask you is, going by the history and going by what you would have seen now, is there any research to show that the next variant is going to be a stronger one? There are a few arguments which are coming out saying that the next variant is going to be stronger than the Omicron. So is there any way to actually guess that?
No, there's no way. Okay. That is definitely guesswork. There's no way. Okay. I think it will have mutations. Okay. Because always remember the virus' sole intention is to survive. Yes. So therefore the virus doesn't want to kill us, but the virus itself doesn't want to be killed. So it will mutate to sort of try to escape our immune systems, but mutate in such a way that it doesn't kill us off. Because if it kills us off, it will die as well.
Okay. Okay.
So that's the only positive thing.
Yeah, yes. So does contact tracing even help? Because this kind of surge, this kind of numbers. So do you think it's futile to actually do the contact tracing now, or is it necessary?
I think, what you can do, looking at how fast it's spreading. So what you can do is if there's a positive patient, you can alert people that was in contact and say, listen, this is what happened. If you have any of the following symptoms, this is what you need to do. So provide people with information. But to go and test a PCR or a rapid test on each and every one just because they have been in contact, especially if they don't have symptoms, you're wasting your money. Because, the rapid test doesn't become positive when you are infected. It becomes positive once if you have enough viral load and to make you clinically to give you symptoms. That's and then still you have to wait about 24 hours to really say, okay, a rapid test is negative. If you do rapid testing about 6 days after you started to have symptoms, you might get a false negative. Then you need to go to a PCR. So if you do a PCR 2 or 3 weeks later, when you thought you had and you still have a bit of a scratchy throat or something, you're still, I'm not sure whether I had it, doctor, can you test me today? And it's 2 to 3 weeks later. If I then test you, 2 things might happen. Because maybe you didn't have a high viral load, that your test can then be negative. Doesn't really say that you didn't have it 3 weeks ago, or the test can be positive, but it's highly unlikely that you will have the virus for 3 weeks. And the virus can't distinguish between dead and, to put it easy, dead and live particles. So that also doesn't help me at all to say you are now being infected. Okay. So it can be a dead virus.
On one hand, India is introducing, several states have introduced weekend curfews, night curfews, and indoor gatherings are banned, a lot of these things. On the other hand, we are seeing political rallies, mass gatherings, that is also happening. So some advice, one to our people, what we need to do, and the other thing to the government, what they could do to contain this surge.
This is politics. It's when politics, the soul of the politics are higher than the soul of the people. And you are trying to get yourself voted in, and you give different rules and different regulations. And, that doesn't make sense. People are not stupid. People will look at this and say, you know what, you don't want me to go tonight to whatever, but during the day you want me to come to your rally? Really? Is that the right thing to do? Can't have double standards. People are not stupid. It's double standards.
So what do you think are some of the measures which we can immediately take on a serious note in terms of containing the COVID surge?
Again, the important thing is, again, try to get a jab in every arm just to prevent severity of the disease. That is extremely important. The second thing is, if people above the age of 60 or 50, depends on how your comorbidities in your country looks like. If you can get them, if after they have been vaccinated, if you can get them to get a booster, that would help a lot. Mm-hmm. But then most important, again, is the wearing of masks. Remember the 4 things that we say. It's wearing of masks, hand sanitation. But here the government needs to play an extremely important role, because you cannot expect people to wash their masks, to wash their hands, if there's no proper sanitation. The government's got a responsibility to make sure that there's good sanitation everywhere, not only in certain places, but everywhere. People should have access to clean water and sanitation. Then you need to look at your ventilation. Again, ventilation, especially in public places, are a responsibility of the private sector who owns that piece of building or land, as well as government who also owns that building. They must make sure that there's proper ventilation. Whether it's schools, doesn't matter. There's a responsibility to make sure that happens. Okay. And then social distancing is again my and your responsibility. My and your responsibility is to wear a mask. Governments must make sure that my masks are clean, but I have the ability, or the capabilities, the infrastructure to make sure that I can wash my mask. Then stay away from groups and vaccines. But vaccines on its own is not going to be the answer.
Thank you so much, Dr. Coetzee, for explaining it in detail on the variant and also some of the tips to contain the surge. It was a pleasure talking to you. Thank you very much.
Thank you so much, and let's hope that your peak is here before my predictions, and that you have the same trajectory than South Africa.
Thank you. Thank you so much. Thank you.
Thank you.